Everybody, it's Dr. Earle here, and it's Hump Day with Dr. Earle. This time I get to spend with you guys and answer all your plastic surgery questions. We are here at Pure Plastic Surgery in beautiful Miami, Florida, and I am happy to answer all your questions. You can talk about anything regarding plastic surgery from head to toe, from pre-op to post-op. And you know you're getting good information because I am a double board certified plastic surgeon. I am Ivy League educated, Duke trained. I've been around for over 12 years, over 5,000 procedures under my belt, and we just keep on going. That's right. Okay, but before we get into the questions here, today I just want to give you just a little brief presentation on something that people ask about all the time, right? Because people are always very curious about this, always wanting to know what's out there, you know, whether it works and everything else. And so what I wanted to talk about today was skin tightening devices, right? So what are the different devices that we have here that help with the skin tightening? Where are they used? In other words, in what setting are they being used? And you know, what type of energy they use and things like that. So let's dig in, okay? So we have several skin tightening devices here at Pure Plastic Surgery. And a lot of which we use in the operating room because, as you know, I do a lot of liposculpture, lipo 360 and BBL, high definition liposuction as well, total definer. So we use a lot of these devices in the OR for those procedures, okay? And then of course we have one that we can use also in the clinic setting, which is done just under local, all right? So let's start with the OR devices. So the first one is not like specifically only for skin tightening, but it does help with skin tightening. So I think it's worth mentioning here. It's actually one of my favorite devices. Like ever since we started using this, I've seen our results just get so much better. And so I think it works really, really, really well. And that is the VASER. Okay, now take note here. It's a VASER. It's with a V, right? It's not a laser. It's not with an L. It's a VASER with a V. Okay. That's the name they gave it to you. They gave it to the device. But the reason is that the energy that it uses is ultrasound energy. Okay, so it's not a laser. It doesn't use laser energy. It uses ultrasound energy. Okay, and so what it does is that it uses these like very, very, very fine and strong vibrations, creating that ultrasound energy. And what the ultrasound energy does is that it knocks off the fat cells from the surrounding tissues. The technical term for this is emulsify. So it emulsifies the fat cells. And so the fat cells are knocked off from the surrounding tissues. And therefore I can then remove the fat cells more easily. And so I can remove more fat with less bleeding and less inflammation. All right. And so that is a huge advantage. But on top of that, because this ultrasound energy does also impart, of course, the energy and some heat, it also does help with the skin as well. And so it also provides better skin retraction than doing just, you know, power assisted liposuction alone. Okay? So the VASER uses ultrasound energy. It helps emulsify the fat so you can remove more fat with less bleeding, less inflammation, and better skin retraction. Because of all those qualities, I use this with 100% of all my liposuction, liposculpture cases and BBLs, okay? And so it is it's already part of the procedure there, okay? Because I think it works so well, I use it on everybody, and it's not really like an optional thing. I think we just gotta use it on everybody, okay? So I use it for all my patients, all right? All right, great. But what if I feel like for any particular patient, the VASER is not gonna be enough, okay? What if we need to add something a little bit extra? Well, in that case, we're going to add something that is, you know, basically solely intended for skin tightening, okay? And we have, you know, two possible devices here, okay? One of them is the one that I've been using for many, many years, which is the Body Tight, okay? From the company called InMode. And so the Body Tight is a device that we can use that uses a different type of energy, and this type of energy is called RF, or radio frequency type energy, okay? So it's a different type of energy than the VASER. The VASER uses ultrasound, this uses RF, or radio frequency type energy, okay? The Body Tight works well, especially in smaller areas. So I think it works well, like for example, in the arms, the thighs, and the chin. When we use it in the chin, we call it Face Tight, but it's basically the same machine, okay? So it's the same machine there. I think it works really well for that chin. I think pretty much all chin lipo cases should have Face Tight with it. I barely, if any, at any time do now any sort of chin lipo without the Face Tight. So the Face Tight is really, really great, okay? And you want to add that to your chin lipo so that you can get better skin retraction after you remove the excess fat with the chin liposuction, okay? It's a very, very good device. It does have some feedback mechanisms which show you just what the temperature is on the patient, on the superficially in the skin and just underneath the skin. It is done in the operating room though, okay, like all of these devices, because these are all devices that have at least one portion of the device going underneath the skin, right? So you can call it minimally invasive, but there's still that invasive portion of it, right? So it is minimally invasive, but it's still invasive, right? It's not non-invasive, okay? As opposed to the Morpheus, which is non-invasive, okay? So that's a good device, especially for smaller areas, arms, thighs, especially chin, okay? And then next, what's really coming out, it's been around for a while, but they're coming out with a new device very, very soon, and we're super excited about this, is the J Plasma. You've probably heard the term either J Plasma or Renuvion. So the name of the company is Renuvion, the device is the J Plasma. Okay, and this also uses RF energy, but it's combined with a helium gas. Okay, and so you got the RF energy combined with the helium gas, and what makes this really cool is that it is, boom, super fast, super efficient. So this works great for large areas like the abdomen or the back. Okay, so if you need some additional skin tightening to a large area like the abdomen, which is probably the most common, or the back for our weight loss patients, then the J Plasma becomes a great tool to add there. If you're still kind of in that moderate skin laxity, realm. Okay, so say for example you've had one pregnancy. So you had one pregnancy, you bounced back okay, you still have some skin laxity and some, stretch marks due to the pregnancy. You feel though, and we feel together after examining you and everything else, that I feel like maybe this is going to do well and that you don't necessarily need that tummy tuck. And so therefore this becomes an option, okay? Again, all Body Tight, J Plasma, all of these are good options for kind of mild to moderate skin laxity, okay? If you have severe skin laxity, you're going to need a surgery. You're going to need a surgery that removes skin. I want to be clear about that, okay? None of these are for severe skin laxity, okay? Okay, if you have severe skin laxity, you need surgery. Okay? Severe skin laxity in the belly needs a tummy tuck. Severe skin laxity in the arms needs an arm lift, etc., etc. Thighs, thigh lift, face and neck lift. I think you get the point, right? Okay. All right. So, but there are those patients now, and when we keep pushing the envelope in this new device, I think it's going to be really, really awesome. And so I'm really looking forward to adding that to our repertoire here so that we can then perhaps avoid the tummy tucks in certain patients that have that moderate, or that moderate plus skin laxity in the belly or in the back, either after pregnancy in the belly usually, or weight loss could be belly or back. Okay? All right. And then what about in the clinic setting? So what about, say you've done all this and you just have this one area that just needs a little bit more of an extra push, right? Or what if you just have some very mild skin laxity that you want to take care of and you don't want to go through like a procedure or operating room or general anesthesia or any of those things. You want to be in, you want to be out, kind of lunchtime procedure, be on your way, get back to your regular life, right? So what becomes the option there? Well, what we can use here in the clinic setting is what's called the Morpheus 8. So Morpheus 8 is RF also, so radio frequency energy, microneedling. Okay, so basically think of it like microneedling on steroids, right? It's like pumped up microneedling, all right? And so that works well pretty much anywhere. So you can use it on the face, the neck. You can use it, you know, in the tummy. You can use it basically anywhere in the body. And so what that does is you have all these, you know, these small needles, depending on where you're using, anywhere from 24 to 40 needles. Okay, and they just penetrate the skin to a certain degree, anywhere from like 1 millimeter up to the max of like 7 to 8 millimeters. And then they also, once they penetrate the skin, they impart that radio frequency energy. That stimulates a inflammatory response, it stimulates the collagen production, and it helps the skin retract and look, you know, look tighter and look smoother. Okay, it is done in the clinic setting. It can be done under just a topical kind of anesthetic, so just a little cream you put on the face. You don't need anything else other than that. Certainly no IVs or anything else. The only kind of downside to it is that you're going to need anywhere from 3 to 6 sessions. Okay, 3 to 6 sessions. It's not a one and done. These are one and done, one and done, one and done, one and done. Okay, this requires 3 to 6 sessions, spread 1 month apart. Okay, but like I said, they're done in the clinic. You come in, you know, I don't know, 50 minutes, 30 minutes, depending how big the area is. You're in, you're out, and you keep going, you know, with your regular life, basically. Okay. All right. So that's just a very quick kind of, you know, summary of all these skin tightening devices. But you know, I just kind of glossed over many things. I'm sure you have questions, so I'm happy to answer that.
Number one, how does this work for inner thigh like tightening?
Yes, so it does work. So when we're considering the inner thigh, I mean, if it's super mild and you don't want to deal with the OR stuff, then you can do the Morpheus. Okay, so that's one option. But for most people, you're going to need something a little bit more powerful than that. And so my recommendation is going to be either, you know, the Body Tight or the J Plasma. And so that can be done in the operating room. It can be done at the time of your liposculpture 360 or BBL. Or pretty much, actually, you can add it on to just about any procedure, whether it's a breast or tummy, mine and cobra, etc. So if you are concerned about the, you know, some skin laxing in your thigh area, certainly bring it up with your coordinator so they can then help you and guide you to what's going to be the best option for you. But once again, remember, if you're in that kind of moderate plus to severe skin laxing in the thigh, then of course you have to also potentially consider a thigh lift.
I have excessive back rolls. Is it possible to get rid of it without having a back lift?
Great. So of course I would have to do an evaluation, but the short answer is, you know, there is that possibility. Again, if you have like moderate excess skin in the back, okay, not severe, not like you lost, you know, 150 pounds and things are just hanging all the way down. But if you have moderate skin laxing in the back with rolls, then usually the best combination for that is, you know, usually you want to do a lipo 360 anyway because you want to address the whole trunk. But I would say a liposculpture 360 with the VASER with the J Plasma. That's going to be a great option for you.
Do you have to get a mammogram before breast aug?
If you're over 40. So that depends on age or prior history. But if you're under 40 and you have no prior history, no family history, no personal history, no problems in the breast, then no, you do not need to get a mammogram. Now, if you're over 40, you do, or if you have a prior, very strong family history or personal history of breast cancer.
Hi, can you keep a stage 1 or 2 capsular contraction without doing surgery?
Yeah, if you're in the lower stages, a lot of times you can kind of treat it in a way where you can hopefully avoid the surgery, or at least, you know, stop it from progressing. So when you have a stage 1 or 2 capsular contracture, it's still not causing a lot of distortion, it's still not causing a lot of pain. And so typically the first line treatment for that is an oral medication that you can use, okay? And you can try that. I would try it for at least 3 months. Okay, it's called Singular. Some of you may be saying, "Whoa, Singular, isn't that for like the lungs or asthma?" It is, but we found in our world, in our plastic surgery world, that the Singular helps try to prevent capsular contracture from getting any worse, and sometimes actually makes it get better and softer. So yes, the singular for at least 3 months, and of course massage. You gotta massage twice a day, be super consistent every single day, really massaging that breast to prevent any further capsular contraction.
All right, we got a two-part question.
All right, part one.
Do you have openings early 2026?
Oh yeah,
And
but January is filling up like, it's like hotcakes, boom, 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 boom. So I mean, if you're talking early January, man, you gotta book now, because I think like, I don't know, in the next couple of weeks, January's gonna be booked up. All right, but February's always there too.
So part two of that question was, are all procedures done in office or in the hospital?
So all my procedures are done here in the office. So we're at Pure Plastic Surgery. We have what's called a office-based surgery center, okay? Having said that, we have the highest safety level and certification that an office-based surgery center can get. Very few people have this in South Florida or Florida at all, and that's by the Joint Commission or JCO. So these are the same people that are certifying the ORs at major hospitals, all right? And so they are the ones that certify us here at Pure Plastic Surgery.
Can I do chin lipo with local anesthesia?
Yeah, you can. I mean, I don't know that I always recommend it. It depends on your evaluation and really how much work needs to be done. Because, you know, if you have a fairly heavy neck or you need a lot of skin tightening, it's just not comfortable to do it under local anesthetic. If you have something minimal, then yeah, potentially it could be done. But I think for the most part, for most patients, you really, in order to get the absolute best result, it's better to do it either under twilight or general anesthesia, to do the liposculpture, and to also add the base tight for the skin tightening.
What is used for pain management, and is it the same for the procedures that you listed there?
Yeah, so the pain management doesn't really change whether you're using any of these devices or not. And so what do we use here? So typically we give our patients pain medication called Percocet, and they'll have that for the first few days. And then after that, they usually switch to ibuprofen.
All right, let's see if you know the answer to this question.
Uh-oh.
What doc would you recommend that does the same good job like you?
Oof. The same good job? I don't know. I think we do a terrific job here. What other docs do I recommend? I recommend the other docs that are here. I recommend Dr. Vidal and Dr. Wigriff. I think they're both excellent. They've been here for several years now. You know, they've been also trained in many of my techniques. And they also, they do some things that I don't do. So for example, Dr. Wigriff will do the drainless tummy tuck. And Dr. Vidal will do all the facial procedures. So I don't do face anymore. So anything that's in the face, neck, nose, ears, eyelids, Dr. Vidal is the person to go for that.
What's the recovery time for those procedures? VASER, J-plasma, and Morpheus.
Okay, so the Morpheus is basically zero, right? It's essentially zero recovery time. You're in, you're out. And then for these procedures, it's going to be based also on what else was done, right? Because we're typically combining with liposuction. So it doesn't really add anything to the recovery time for liposuction. So with liposuction, of course, in the first 6 weeks, no heavy lifting, no strenuous activity. You have to wear your compression garments and you have to get your massages, right? And so we're adding these things to the lipo, and you still have to do that. You still have to wear that compression garment for 6 weeks, night and day, then an additional 6 weeks, 12 hours a day. And I still recommend, especially for larger areas, about 20 post-op lymphatic massages.
Can you do a mommy makeover plus BBL at the same time?
I don't do that. So there are people that do it. I don't recommend it. I think that when you combine those two procedures, the complication rates start to go way up. And as many of you know, here at Pure Plastic Surgery, your safety is my #1 priority. And so I do everything I can to minimize risk. And so when you combine those two procedures, complications for things like infection goes up, for bleeding and the need of blood transfusions go up. And most importantly, the risk for blood clots goes up, okay? And the reason why I say most important is because that can cause serious problems, okay? That can cause respiratory distress, can put you in the hospital, in the ICU, or even death, okay? So the risk goes up when you combine those procedures for blood clots, and that's just something, a risk that I'm not willing to take for my patients.
Nurse here, how long do I have to go without sitting after a BBL?
All right, so if we're doing a BBL, you're not going to be directly sitting for 6 weeks, okay? Having said that, there is a special pillow device called the BBL pillow, which you can use during those initial 6 weeks to sit using that pillow. What that does is that it kind of goes under the thigh area, and so the pressure is being placed on the thighs